Aboriginal health is, of course, one of the key examples in relation to social determinants of health. The Australian society has been riddled with that inequality for many decades now, and it's very difficult to see where should one start addressing that problem. During my residency, a very particular problem came up that was very new to me also as a European, that of course in South Australia your identity card is your driver's license. And that I was made aware of the fact that it was very difficult for Aboriginal people for a number of reasons to get a driver's license, and therefore if they didn't have a driver's license they didn't have an, in quotes, an official identity. Of course they had their personal identity, and that this caused many other problems, and that of course a vicious circle started, that you could not move without having the official permission to drive a car, vehicle, but many of them just needed to be mobile, and then they ended up in correction facilities. So we actually took the concept of social determinants of health and applied it and said, in the context of Aboriginal health and well-being, the access to a driver's license actually becomes a social determinant of health. That was quite controversial at the time, but I've been told that in one of the Health Lens analyses that is now being conducted, that this issue has been taken up again, and that's actually new pathways for an easier access, not in terms of standard, but in terms of accessibility for Aboriginal people to driver's licenses has been achieved.